human sexuality is as important subject as it is a touchy subject. Um, as physical therapists push for being primary care providers, it is something that is going to be important to discuss with our patients because it getting to know your patient allows us to help treat the patient, where it is appropriate. You don't need to know certain things to treat certain cases, but knowing sexual orientation and um, sexual activity is important when treating certain cases. Whether the individual is has a spinal cord injury or arthritis or whatnot. It's also um, helpful to rule out maybe some sexually transmitted infections. It's just also being appropriate and comfortable. I think checking your own bias and stigma, prejudice is um, is important because patients aren't comfortable talking about it. Um, you know, if you're not comfortable talking about it, this is watching empowering language versus diminishing language. Part of what we've talked about. Um, you know, it it's just an important subject because I mean it's really um, a basis of who people are as individuals. Um, so there's a lot of relevance of talking to the patient about this. If it's something that you can't treat, you know, where to refer them, such as like a therapist that specializes in women's health or men's health, um, or just a psychiatrist or any kind of treat. Because the lesbian, gay, and transgender community are more prone to tobacco use, alcohol use, and certain STIs, which can make them more prone to certain types of cancer. So ruling out certain things, it can be important. So it's just the fact of being comfortable with talking to patients with this, as um, a physician or a physical therapist push for direct access and being a primary care physician. Um,